असतो मा सद्गमय तमसो मा ज्योतिर्गमय मृत्योर्मा अमृतं गमय। शान्ति शान्ति शान्तिः।
Service to man is service to God. Manava seva, Madhava seva. Jana seva, Janardana seva. Nara seva, Narayana seva. With this humble objective, Samatvam, referring to equanimity or yoga, began its public service activities in 1987 in New Delhi, India, with the inspiration of Padma Shri Professor Manmohan Singh Ahuja, the scientist, sage and father of Indian endocrinology diabetology. The service areas of Samatvam include healthcare, education, research and social welfare. Beginning 1993, enriched by a small group of doctors, counselors, social workers and volunteers, Samatvam Trust crystallized as a grassroots healthcare institution based in Bangalore. Endocrinology, diabetes and related disorders and community medicine were the primary focus. In 2003, led by doyens of our nation like Dr. G.V.K. Rao, Dr. H. Narasimhaya and Sri M.A. Srinivas, Samatvam Trust established Jnana Sanjeevini, referring to knowledge for eternal health, as an all under one roof multi-speciality diabetes endocrinology daycare center in its own premises in JP Nagar, Bangalore. Since 2014, with the continued inspiration and support of revered Honorable Sri M.N. Venkatachalaya, Sri A. Ramaswamy, Sri G.C. Surana family and other Margadarshis, patrons and benefactors, Jnana Sanjeevini is trying to extend basic hospital inpatient services to the needy at its premises. Since its inception, besides our daycare centers, the Samatvam team of specialist endocrinologists, diabetologists and diabetes endocrinology counselors also provide comprehensive outpatient, inpatient and 24-hour emergency services via several affiliated secondary and tertiary care hospitals spread across the city of Bangalore, catering to every socioeconomic segment of our society. In 2012, Samatvam completed 25 years of public service, touching the health and lives of more than 1 lakh fellow citizens with diabetes, adults and children, poor and rich, from Karnataka and neighboring states and even other parts of India, and few from other countries from USA to Australia. No one will leave Samatvam Jnana Sanjeevini uncared and unprovided, irrespective of their socio-economic status. This was our opening credo. We continue to preserve and persevere this till today. Service with devotion is our motto. Each patient deserves the best of our knowledge, skills, and most importantly, humanity. Healthcare of highest possible quality to the highest possible quantity is the universal need. People and team are our core and perhaps only strength. Patient is always the captain of our team, Together, everyone achieves more. Commitment to reach out to the poor and needy is permanent. Power of prevention is our slogan. Diabetes and its complications are preventable. Heart attack, strokes, blindness, kidney failure, gangrene, leg amputations are preventable. Angioplasty and bypass surgeries are preventable to a major extent. The answer is in your hands. Samatvam Jnana Sanjeevini is there to help you. During this long journey, at several steps, we have pioneered novel diabetes patient and public health education programs, innovated outreach rural and urban diabetes camps, and implemented model self-help community care services for our people and nation, all with social relevance for human and societal good. Through these activities, Samatvam, despite being a small grassroots organization, has earned to its credit several firsts or earliest or largest in the healthcare arena of our country. These include implementation of structured hospital, clinic and community-based diabetes patient education programs, training of diabetes educators, counselors, specialist nurses, physician assistants, social workers and podiatrists, organization of childhood diabetes clinics, residential diabetes camps and patient-parent support groups. World's longest and busiest 24-hour free diabetes helpline, which has even catered to patients and families from far-off countries across the globe for both general and emergency medical support. Successful utilization of mass print and electronic media to disseminate our message of power of prevention. Implementation in 2002 of the first certified insulin pump and continuous glucose monitoring program in India. Peers for Health or Madhura Sanjeevini, wherein diabetes patients or their family members are themselves trained, equipped, deployed and empowered as community health workers or so-called barefoot doctors to serve as health ambassadors for their own community, that is villages and urban slums. Samatvam helps them help themselves. The highlights of Project Disha, which supports type 1 insulin dependent diabetes children and youth, include free childhood diabetes clinic, free insulin lifeline and insulin for every child, and insulin plus education, wherein possible financial support is provided for their formal school and college education towards making these youngsters proud and productive citizens of the nation. Project Dosti supports type 2 non-insulin dependent diabetes adults through free adult diabetes clinic, free medicines, that is health for helpless program and other social welfare activities. Project Deepa is directed towards diabetes physicians, counselors and other health professionals. This fosters the much needed diabetes healthcare manpower development and capacity building through local, national and international scholarships, observerships, internships and fellowships, and continual medical education and training. Samatvam alumni, that is medical and other students, physician, resident, fellows and consultants, nurses, counselors, social workers and scientists, all inspired, trained and nurtured by Samatvam Jnana Sanjeevini, are currently serving people and communities across the world in various specialities and capacities. In collaboration with Public Health Foundation of India, Samatvam has trained the record highest number for the country of primary care and specialist doctors to deliver higher standards of diabetes care for the people and families served by them. The philosophy of service with devotion, scientific spirit, and passionate and compassionate medical care have been intensively infused. In the area of scientific and social research, Samatvam has focused on diabetes care in resource-limited settings, patient education and empowerment, and psychosocial support and spiritual medicine. With increasing globalization in science, Samatvam has been in the international forefront of several drug and device clinical trials with an emphasis on patient safety, good science, future promise, and most importantly, applicability and relevance to the Indian society. Respected friends and fellow men, it continues to be a long and fulfilling journey. Humanity has always realized that hospitals are temples, churches and mosques. Revered patients are living gods. Doctors and other health workers are priests and devotees who have been gifted with the divine opportunity to worship and to be blessed. In this path, Samatvam is a continuing vision, an ever-challenging mission, a growing healthcare team, and a committed professional family. In the context of healthcare, bridging the best of East and West is our goal. Integration of science and spirituality is our foundation. Our journey continues. The woods are lovely, dark and deep, but I have promises to keep and miles to go before I sleep. And miles to go before I sleep.
Sarve bhavantu sukhina. Sarve santu niramaya. Sarve पश्यन्तु मा कश्चित् दुःख भाग्